Good afternoon, Premier.
We are happy to have Jackie here. This is our weekly video update. Christina was on us this morning.
Afternoon.
Thank you. Yeah, afternoon, actually. She just messaged us. Um, so I apologize for the delay, but it's been a hectic week. We did just post an update to you guys on in the general channel on Zoraida and Janelle. So if you guys could please take a look at that and respond accordingly. Uh, on a different note, we have onboarded all of our physical therapists into Slack. So we are able to direct message them, as well as they have access to the group channels that they are applicable to. So going forward, PTs, I did post the intro to Slack video for you guys, which gives you a really great kind of run through on how the program works, the different features, how to set them up. I definitely recommend taking a few minutes to watch that video. It's literally only a 2-minute video, I think. And it's pretty self-explanatory once you get the hang of it. But take a few minutes, look through it, set up your notifications so that they're not incredibly annoying, because I get very annoying very quickly if you don't do that. And you can set them so that you're only alerted on certain keywords when you're tagged in things. And so the program's actually pretty smart about figuring out what you need to be notified on and what not. The purpose for us doing this is that front office coordinators and management need more direct access to you guys. We want more communication coming to and from you guys. We want more educational material going to and from you guys. I'm also coming back to try and help facilitate some operational changes and optimizations. And so your positions are something that I'm looking at and trying to enhance as well. So with that, front office coordinators and TLs, as well as the owners, will be directing patients that need to be discharged to you in Slack. So they will be tagging you in the discharge requests that are in the general channel, and then it is up to you to make sure that you check that. Either respond or react, which would be a react would be a thumbs up or something, one of the emojis that you can do. Just some type of virtual acknowledgement that it was received and done. And that way it'll hopefully smooth out some of the process for us. We'll also be communicating directly with you guys on flow sheet fixes. So again, we don't need to go to the FOC who then needs to go to you. We're just cutting out the FOC, going right to you. And again, hopefully we're thinking that this should smooth out some of our processes. We're having a little bit of hiccups on discharge records and things. In addition to that, it is now going to become mandatory that you guys attend the PT webinars for WebPT. They do good webinars about every month to keep us up to date on the insurance changes, different practices in the PT world, and it's just some really good information for us to be having our PTs digest as we head into a little bit of a growth spurt here. So that will be mandatory, as well as we'll probably be posting some articles and miscellaneous things. I would also like to encourage any PTs that do reading, outside of work. Please feel free to drop in comments, articles that you recommend to the other PTs here to read. We are really working towards some more collaboration, so definitely feel free to contribute in that channel as much as you'd like. Now, for the FOCs, like I just explained to the PTs, we will be utilizing them in Slack. So please communicate with them in Slack so that we start having documentation, as well as more open communication, like I said, so we can see, where everything's going. So discharge requests, you will be communicating directly with the PTs. I also ask that as they start to digest this transition, you guys have already had about almost 3 months.
God, yeah.
Almost 3 months in Slack, so hopefully that habit is built. You're checking it multiple times a day. If you guys could please be supportive to your physical therapist, help them remember in the morning to check. When there's a video, remind them to check that video, and then here in a couple weeks they'll be fully on board with you guys. As far as the reviews are concerned, every single clinic now has a review, and so we're doing a great job on that. South Loop is definitely in the lead here. Ashland is a very close second, and then Evergreen is a very close third. So, great job to everybody who's gotten reviews. That was definitely the objective. Keep up the great work. There is still a week left. Well, 10 days left actually of the competition.
I can't believe it.
I know. It's almost
already almost July. It's
I know. So definitely keep that up, and I'm gonna pass it over to Jackie for some FOC updates.
I'm good.
All right. So
what was I gonna say? Keep with the evals, revals. I know a lot of you are still trying to get those. I know. Have you had any update with Rakic, Dr. Rakic with MMI? Because that is one of our main issues, and just keep trying to call there. There's even an email listed, I believe.
Yes, and I'm just checking this right now. I think I did send a new fax number.
Did you? And I just missed it.
Okay, so there's not a fax number for Dr. Rakic. Is that how you say it?
I thought it was Rakic.
Rakic.
Whatever. They know who I'm talking about.
Yes. So the problem, doctor, there is an email in the patient compliance channel for this doctor to get those documentation signed. I'm copying it again in this channel so that it's fresh. So please make sure that you copy it, put it somewhere, and you can direct anything that we need signed by that doctor to that email.
Yes.
And then if you still continue to have problems with it, just respond back in the patient compliance channel, and I'll continue to work on that. But Dr. Erickson, we have resolved. We want to make sure that we're sending it to the Windy City office. One of the other FOCs posted in there with an update for one of the other fax numbers. So I think we should be square here on some of the outstanding ones. So definitely let's try and wrap that up. And if it becomes a problem again, please let us know. Other than that, keep up the awesome work. I'm really excited to see you guys next week and get these reviews finalized. I'm going to be working on getting some food, so if anyone has any special requests for that Friday meeting, now or never. I'd appreciate some suggestions, though. And
I can only imagine what they're going to suggest.
Yeah, well, let's look forward to it. Chat with you guys soon. Have a good one.
Bye.